And this was the first time that they looked at it and said, that's very good. It was very
cool.
low, right where they wanted it to be.
All right, well, hey everybody, this is Dr. Bulow with Revive Upper Cervical Chiropractic, and today I'm joined with Jackie.
Hello.
And you know, Jackie and I were just chatting. She's been a client of ours, a patient of ours for a year now.
Yep.
Which is pretty cool, celebrating a year of spinal alignment. But more than that, what proper alignment has been able to do for Jackie in just her overall health, and in particular in your diabetes. I mean, a lot of people would say, what in the world can chiropractic care do for diabetes? You know what I mean? But you can maybe just tell it from your own perspective. What brought you into the office, and what are some of those things that you saw kind of changing over the last year for you?
Well, really, I had the same reaction as you said. How can chiropractic care help diabetes?
Yeah.
Actually, my dad, Ed Toten, came here first, and he was telling me about all the wonderful things you've been doing for him. And before I came here, I was constantly sick.
Yeah.
Like every 3 weeks, I was going to the doctors. They knew me by name, actually.
Really? Yeah. What kind of sicknesses? What kind of, like, was it just
ear infections, mainly sinus infections. Like if it was in my eyes, behind my ears, I get sinus infections. I get the flu a lot.
Yeah. So the immune system just not up to par, right? You know.
So I was going to the doctors constantly,
Yeah.
and my mood was just not what it should be. I was kind of depressed.
When you're stressed out and your body's inflamed, you know, that it makes sense. It would cause a lot of anxiety, depression, just stress in general for sure. But he twisted your arm and got you in here. What was that like, your first experience? Because I mean, every chiropractic clinic's a little different, right? We kind of specialize in what we specialize in. But from your perspective, how was those? Do you remember now? It was a year ago now, but how would you explain the first few visits? If someone was kind of like, I don't know if I should go to a chiropractor, or I've already been to chiropractors, or I don't know, that guy looks a little scary. I don't know. But what would you say to someone? What was the experience of your first few visits with us?
Well, my first experience, I was kind of, I don't know if this is going to work, really, because I had been to several physical therapies because I had fallen off my grandfather's swing. When I was swinging, I was in full swing, the swing broke under me, and I landed flat on my back. This happened 3 times before I came here.
Wow.
And I was going to several physical therapists, and none of them can really do anything for me. And when I came here, I was like, I don't know if this is going to work. Physical therapy hasn't worked for me.
Sure.
And actually, my back pain didn't immediately go away, but I saw a difference.
So at the end of the day, there's always a kind of a fear or of the unknown, you know, and just knowing if it's going to work, or if the provider, if you're going to get along with them. And I think that's a fair concern for anybody. There's so many different doctors and therapists. We really try and treat people like family, you know. So there's that. What about how have you been feeling over the last year? How have your numbers been? How has your energy levels been? What's been going on for you over the last year since you started care?
Well, over the last year, it's actually been really amazing. I went to my diabetic doctor, my endocrinologist, and they're always, you need to get your A1C down. It's very important that you get your A1C down. And I always had it where they wanted it, but they always said if you can get it a little bit lower, that would be great. And this was the first time that they looked at it and said, that's very good. It was very low, right where they wanted it to be.
Nice, yeah. And I had a friend of mine who had some case studies that were similar. There's this connection between the spine, right, and the nerves, and how well your brain communicates with your body. Like if I pinch the nerve to my hand goes numb. But what if I irritate the nerve to my pancreas? It's not like someone says, I've got pins and needles in my pancreas, or my pancreas fell asleep while I was at school today or work today. It's like, we don't hear those things. But you can imagine if the nerve's irritated, where in the hand it will cause the hand to get irritated, in the pancreas, those cells are not going to work as well as they should. It's either going to work too much or too little, you know what I mean? Produce too much of a chemical or too little of a chemical. If the immune system's irritated, it's going to think that there's a virus or there's a bacteria, and so your body's always kind of inflamed, fighting stuff, and that's where, sinus infections and all these different things, everything's just inflamed and swollen and irritated. And after a while, your body gets tired. You know what I mean? So yeah, maybe it doesn't produce as much insulin. Maybe we don't get out of bed with as much energy as we should, you know? And we're just really glad that we were able to take care of you, because it's so exciting when you said about just having more energy, better mood, you know, all that kind of stuff.
I remember the first like 3 or 4 weeks I was coming here. I came home one day and I told you I was going to see the doctors like every 3 weeks. I came home one day and I realized it had been a month. I told my mom, I said, Mom, I haven't been to the doctors once.
Cool. Yeah, that's neat.
And she was just amazed by the fact that I wasn't going to the doctors nearly as much.
That's cool.
And just recently, a few months ago, I got a small virus. And usually when I get a virus, it turns into a sinus infection or an ear infection. And I'm sick for like a month, 2 months tops. I recovered in 2 weeks.
That's pretty cool.
Since I came to see you.
Yeah, that's neat. That's what it's all about. I mean, it really is. Anytime I talk to people, Jackie, like this, I'll usually give them the opportunity, if they'd like to, say things to folks that might be watching that maybe have never been to a chiropractor, or maybe they have. Maybe they've been to a million chiropractors, and they think, I don't need another one. I've already been to one of those guys. But is there anything that you would say to somebody to just give them a better idea of what this is all about, or just any of your thoughts on the practice here for folks that may be introduced to it for the first time?
Well, I'd really just say try new things.
Yeah.
Even if you think it has like a skin over it that you've seen before, I think you should delve a little deeper.
Yeah, of course. Yeah.
And I mean, you've improved my health greatly. I think
cool.
someone else's health can be improved greatly too. And I'd just say try everything.
You got nothing to lose but the pain, right? I mean, you got nothing to lose but the dysfunction, really, in most cases. So I think you're spot on with that, Jackie. Thank you for taking the time, and thank you guys for watching. Hopefully you've been encouraged and inspired as I have. And I always forget to say this at the beginning of the videos, but please share it. You never know. There's so many people in our lives that may be suffering with issues like this, and we don't even know. You know what I mean? So videos like this can sometimes give people information, inspiration, and if they're not from our region, they can still contact us, and I'll find you someone who's qualified with similar credentials and does a similar type of work in your area. So you could be anywhere in the country or anywhere in the world. We just want to be able to help out. So thanks for watching. Thanks again, Jackie.
Thank you for having me.
All right, guys. We'll see you next time.